If you're considering regenerative medicine for treatment of joint aches and pains or tendon problems, including things like plateletrichplasma or PRP or cellular or stem cell therapies, and you're trying to figure out whether or not these therapies are going to actually work for you, then stay tuned for this video because I've got some information that can help you point you in the right direction. I'm Dr. Brad Homan, board-certified orthopedic surgeon, and I have seen thousands of patients with knee arthritis, tendonitis, various conditions like that. Very experienced in regenerative medicine, including cellular therapies as well as plateletrichplasma. And what I've learned and what's important when it comes to regenerative medicine is we're relying on our body's own healing response to get the desired effect. We're trying to inject these therapies, these substances into the problem areas to either cure the problem completely or symptomatically reduce the pain and improve function. And so if you're trying to optimize your body's response and heal, then your body needs to be optimized to do so. And so there are a few other things outside of the injections that can affect your ability to recover after a regenerative medicine procedure. So the first is if you've got uncontrolled chronic medical conditions, things like diabetes that are out of control, cardiovascular disease. These are all things that will affect your body's overall capacity to heal. And so it's very important to try and optimize these medical issues, bring them down to normal level to keep your body functioning as well as it can. The other thing would be lifestyle changes such as diet and exercise. And I know it sounds cliche, but it's true and it's important. First off, with the diet, there's a lot of really bad stuff that's in our food today, and we don't even really know it, and we don't really think about it, and it's not really advertised how bad it is for you. But things like preservatives or additives in food, added sugars, things of that nature, all of those chemicals are unnatural and create inflammation in your body. And if you're trying to reduce inflammation in a certain joint or an inflammatory condition, then ingesting foods that create more inflammation in your body are obviously counterproductive. So what you eat is important. Healthy fruits and vegetables. You want to have a diet that gives your body all of the nutrients that it needs to function more appropriately. The other thing is an exercise program. If you're sedentary and you have joint aches and pains, they're not going to get better without movement. Your muscles surround the joints and support your joints. And so if your muscles are sedentary and not moving very much, they will tend to get stiff and achy. Movement also strengthens the cartilage in the joints, and so it's very important to be involved in a low-impact exercise program to keep those joints moving, keep the health of the cartilage, and also to preserve the muscles that support the joints. By the same token, included with an exercise program would be weight loss if you happen to be overweight, especially for load-bearing joints in the lower extremities, such as the hips, knees, and ankles. Because if you have more weight on those weight-bearing joints, it's obviously going to put a lot more stress on the joint and create more problems. And so lifestyle changes that include better diet, exercise, weight loss is all going to be beneficial. And if you're trying to optimize your results after a regenerative medicine procedure, then those things are definitely necessary to help with the process. Other things that can be effective would be like light therapy, what we call photobiomodulation. In our office, we use a laser, and that intense red light that penetrates deep gets absorbed by the mitochondria in your cells, and that actually creates increased energy production of the cells. So it makes the cells more efficient, and that means that the cells that are working on the healing process, the cells that are working on turning into the tissues that you need, are going to work more efficiently because they have more energy. And that's especially true as we get older, because a lot of times as patients age, the cells become senescent, or they basically slow down a little bit. So the absorption of that red light can kind of decrease the senescence and improve the capabilities of the cells to do what they need to do. And so laser light is one example of a way that photobiomodulation can be effective. But an even more natural, easy approach is get outside, because the sunlight has that red light frequency that'll help ramp up the cells. And so being outside has multiple other health benefits in addition to that, but that's another lifestyle change that you can make that's going to actually optimize and help with your regenerative medicine procedure. So I hope that was useful information for you. If you are going to go through regenerative medicine, don't expect the injection itself to do all the work. It's very important to optimize your own health and nutrition so that your body can do the healing process that it needs to. So if you found this useful, please like and subscribe to my channel, share it with some friends. I am Dr. Brad Homan, and as always, my message is take care of yourself and your body will take care of you.